This is going to be a quick look at hip flexor tendonitis, which is a very common problem. So looking at the symptoms of this injury, tendonitis is caused by tendon inflammation. And in case you don't know what that means, a tendon simply connects your muscle to your bone. And you have hundreds of tendons throughout your whole body, but in the hip flexor alone, there's several tendons. And even one of them becoming inflamed will cause you substantial hip pain. Now, the pain itself can vary based on the location and severity of the tendonitis. But typically, it's going to be towards the front of your hip, right over the pelvis area, as you can see in that picture. For most people, it's going to be a nagging pain, almost like someone is tugging on your muscles every step you take. It will likely hurt if you even try to lift your knee up towards your chest. That's one of the best tests for hip flexor injuries. Now, looking at what causes hip flexor tendonitis, it's primarily an overuse injury. This means your training or activity has placed more stress on the tendon than it can handle. Now, while it can happen in any activity, tendonitis is very common in sports that require a lot of repetitive motion that involves the hip flexor. This includes dancing, running, cycling, and a number of other intense sports. Now, you can often keep training with tendonitis, but it's really not a good idea. It can lead to secondary injuries like bursitis, which will take even longer to heal, but it can also cause any number of other injuries if it causes you to alter your normal movement to avoid pain. So bottom line, if you think you have it, get it treated. And what does treatment consist of? Well, you might not like to hear it, but rest is the number one thing you can do. As with most inflammation, there's really nothing you can do other than let it go down, let your tendon heal, and then you can go back to activity. Now, while it's healing, you want to make sure you don't make it any worse. So in order to do this, you want to avoid stretching in particular and any activity. Now, if you absolutely have to do some activity, maybe it's a big game or event, you can control the pain by taking the recommended dosage of an over-the-counter anti-inflammatory, and it's usually necessary to ice the area after. Now, when you go back to activity, you don't want tendonitis coming back right away, which makes sense. So you should know that after you rest, you get healed, your hip flexor is going to be weaker because you haven't used it like you usually do. So if you jump back into activity like before, you will have your tendonitis back right away. So instead, what you want to do is complete a rehab program prescribed by your physician, because he or she will know what kind of rehab program you need. Now, in the future, if you don't want to develop tendonitis, you have to know what your limits are and avoid overtraining. That's the only way. And finally, if you suspect you have hip flexor tendonitis, you have to get treatment as soon as possible, or it's only going to get worse and it's only going to take longer to heal.